Does your knee buckle or give way when you're walking? Does it feel like it's unsteady or unstable? Well, if so, this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what can cause your knee to buckle when you're walking, when to worry about it, when not to worry about it quite as much, and what you can do to walk more comfortably without your knee feeling unstable. So there are some serious things that can cause your knee to buckle when you're walking. For example, severe meniscus tears or ligamentous tears can make the knee structurally unstable. But fortunately, if you haven't had a traumatic injury like a sports injury or a car accident, those are rather rare. Most cases where people's knee buckles is because of the way that they're walking. And the good news about that is that if you change the way that you walk, then you'll be able to walk more comfortably without your knee bothering you and without needing surgery to repair some serious damage in your knee. So we'll go through some tips to be able to walk and improve your knee stability. Now, if these don't work for you, it's probably a good idea to get it checked out to make sure that there isn't some serious damage. But again, if you haven't had a traumatic injury, it's very unlikely that something severe like a ligamentous injury would occur. So tip number one, the most common reason that people get knee buckling when they're walking is because of the knee going inwards like this. If you imagine a building that's held up by columns, if those columns or pillars are lined up straight, then it makes the building very stable. But if the pillars buckle inwards like that, then the building can fall. And that's kind of the same way that your body works. So if your foot's flattening down too much or your hip's weak and your knee's going inwards when you're walking, then that can cause your knee to buckle or give way. So the way that you stop that is by making sure that your hip, knee, and foot are all in alignment when you're going to take a step. Now, for some people, their knee will naturally buckle in, and that's usually a sign of hip weakness. So if you are someone who feels like your knee buckles, make sure that you're hitting with everything in a line. Now, to practice that, you can practice weight shifting forward onto your leg, and then shifting back off, shift forward, and then look down and see where things are aligned. And if you notice that you're kind of coming inwards or that your knee is inside of the line straight down from your hip to your toe, then you want to turn out just a little bit to make sure that you have everything lined up in a stable alignment. So that's tip number one. And you can practice doing that, again, just loading weight out on that leg, picking the back leg up like you're going to take a step, and then shifting back off. Shifting onto the front leg, and then shifting back off. That's tip number one. Now, the second reason that people's knee buckles when they're walking is that if they don't have their knee fully straight and their body weight is behind their foot, if the knee's slightly bent like that, then if your muscles don't activate in time, it'll cause you to temporarily feel like you're falling until your quad muscles or your thigh muscles kick in and realize that you are falling. So it's important to be able to get your knee all the way straight when you are walking. Now, if you do have knee arthritis or stiffness in your joint, you may find it difficult to straighten the knee out all the way. But fortunately, there is a self-stretching or joint mobilization technique that you can use to get your knee straight. And here's how you do it. Take a towel and put it underneath your knee. You don't want to leave a big gap in your knee. And because the tibia or the lower leg bone glides forwards, you want to put it just below the knee, underneath the tibia. You want to have enough towel there that it kind of fills what gap there is, but you're not directly behind the knee, you're just a little bit below the knee. That way, when you go to apply pressure, this is stabilizing the tibia just below the knee joint. Now, when you go into extension, your tibia is going to glide forwards, your femur is going to glide backwards. So it's this direction of a motion on your knee. Additionally, when you get into the last few degrees of knee extension or knee straightening, your lower leg bone or your tibia rotates outwards a little bit into external rotation. So to help get those movements moving better so that you can straighten your knee, here's what you do. You take one hand and put it up on your thigh and just kind of press down like this. So you're putting pressure down that way. If you need to use your other hand, you can, but you're probably going to want to have this other hand free if you're able to. Now, with the other hand, you kind of grab around the tibia. So you have one hand on the femur, one hand on the tibia, and then you're going to rotate this hand inwards while applying a little pressure, while rotating the lower leg bone outwards. It's going to be a motion, kind of a twisting motion, while also pushing with this hand. So you twist like that, and then just press this way. Now this is not a huge motion. The joint mobility is really, really tiny, about 1/8 of an inch. So you're not going to get a whole lot of movement. It'll probably just feel like you're pressing up a resistance that really won't go anywhere. It's important to have this towel because you're not trying to press the leg down like that in an arcing motion. It's a gliding motion like this. So again, one hand on the femur, one hand on the tibia, kind of between the tibia and the towel, and then you're pushing down with this hand while turning outwards with the other hand. And so that's a little self-joint mobilization to get your knee joint to extend or straighten better. Now, after you've done the joint mobilization technique, it's still important that you actually use the knee extension that you've gotten through that technique. It doesn't matter if your knee can straighten out all the way if you don't straighten it out all the way. So it's important to get your knee fully straight when you're walking. Now, another tip that helps to improve the stability is, again, if your knee doesn't straighten all the way or you're not straightening it all the way, if your body weight is behind your foot when you go to take a step and that knee's not straight, there's the potential for you to cave down. However, if you take a shorter step and push off your back foot rather than pulling forwards with your front foot, your body weight hits over top of your knee or even slightly in front of your knee. So there's no leverage to pull you down this way if your body weight is directly over your knee or just slightly in front of it. So when you're walking, instead of hitting with a heel first gait like that, if you think about pushing off the toes of your back foot and landing with your body weight over top of your front leg, that's a much more stable way to walk so that your knee doesn't buckle when you're walking. But there are some times when you do need to be able to bend your knee. For example, going downstairs. That's one of the most common times when people feel instability in their knee, and also probably the most common time when people fall because of their knee buckling. So to be able to go downstairs without your knee hurting, I'd suggest that you check out one of these videos over here. But before you go, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.